Thank you all for joining our mental and behavioral health community speak out. My name is Diane Tanner, one of the leaders of the Council of Youth and Adult Advocates and a part of the Campaign for Healthy Minds and Healthy Kids. I'm from Rochester, New York. I'm also a family care advocate, just recently credentialed for New York State. Also work with the behavioral health with mental health with BIPOC Peak and the VIP with the Children's Agenda. Thank you. Today's Community Speak Out is our chance to connect and hear from young people, parents, and caregivers across the state on what they think are the challenges families and communities are facing with New York's mental health crisis. One of the main themes you will hear about today is how hard it is for anyone to access the care that they need. And while we know how to help them, many youth and families are forced into year-long wait lists for the life-saving help. We are at a breaking point, and I know everyone here today has a personal connection to this issue. As someone who has needed help or someone who knows a young person who needs that help. I don't know how you are feeling, but if you're like me, I want to make sure that this and future generations never experience their call for help to go unanswered. Here to share more about how we're going to be doing that is my co-host Carlos, who will share some information about the campaign for Healthy Minds, Healthy Kids, and our advocacy. Carlos.
Thank you, Diane, and welcome everyone to our event this evening. So my name is Carlos Rosales. I'm the Director of Community Outreach and Engagement at Citizens Committee for Children of New York. And I'm one of the organizational partners supporting our campaign for Healthy Minds, Healthy Kids, which is a coalition of behavioral health, which is mental health and substance use providers, advocates, youth, parents, caregivers, and families that are working together to create the public and political will needed to make sure that all children and young people in New York receive high quality behavioral health services they need. This past year, as Diane alluded to, our campaign has been working hard with our Council of Youth and Caregivers, as well as member organizations in our campaign and providers across the state to urge state leaders to commit to $195 million into the Children's Behavioral Health Outpatient System to address the severe workforce crisis and reimbursement rate challenges that are keeping children from accessing timely, high-quality services. But we know this is just the starting point. And here today, and why we bring you together with us in this space, is making sure that we are not only connecting with providers, but hearing from parents, caregivers, young people, hearing from all of you about what we need to do across New York State to ensure that our state budget has the support and the resources needed to help children, youth, and families thrive. And so I'm excited to have you all here with us, excited for the lineup of speakers that we have, and passing it back to Diane to take a little bit of time to talk about what you can expect to hear from our speakers.
In a moment, you will hear from our speakers about what it is at stake this year as we advocate for mental and behavioral health support, what youth and adult advocates about their experiences, hear about what we are doing to engage you in our campaign, learn how you can take action to support our children, youth, and families across New York. But first, Carlos will take you all through a short interaction activity to hear from you, our audience, their perspective, our mental health support for young people. Carlos?
So everyone, if on your screens and you could indulge us, I think one of the things that we would love to hear from you engaging in this space is to understand where you are coming from when it comes to issues around mental and behavioral health supports. And so for this first mini activity, before we get to our lineup of speakers, I want to hear from you and get to this question on wondering if you think your life would be different in a positive way if you have been offered any mental health support as a young person. And so to help complete this activity, you can scan this QR code on the screen or go to menti.com and enter this code 3502369. So if our audience can go and follow those instructions and get to the online activity, we'll start our program to kind of hear a little bit from you about where you feel like you or those who you care about and love might be where they getting the supports they needed on time. So I'll just give our audience a minute to join the Menti, and I see people are joining right now. I'll make sure you get another 10 seconds to join, and then I'll change the screen so that way we could see where you feel like you're at. And again, in the chat, if you need to copy and paste the web URL or the code, you can look at the chat for that message. Okay, so I think we have a critical mass. And so for this first part, the question is, do you think your life would be different in a positive way if you had had any mental health supports as a young person? If you feel like it's less of a positive change, pick a lower number, and a more positive change, select a higher number. And I can see already from our audience that we see and understand how important mental health support really is, whether it was for yourself at a young age, which is a critical and important time to intervene and help make a difference, or support that is needed for someone that you might know. All right. And so if anyone, feel free to share with us in the chat any more details on how mental health supports could have made a difference for yourself as a young person or someone you know. We always love to hear and understand from our wider community how changes and how these kinds of services can make a difference and really guide us to a point where we understand what are the types of supports we need to make sure continue to exist or are supported in a community if they're not there. So appreciate everyone for taking the time to participate in this quick activity. We'll have more later in our program, but now I want to pass it back to Diane to begin introducing our first speaker and the main program for today.
Thank you, Carlos. We would now like to introduce our first speaker, Preem Cabby, another leader of our Youth and Caregiver Council, who will give us an overview of why mental and behavioral health supports are so critical. Preem, welcome. Please take a moment to introduce yourself and share with our audience what issues you see families facing. Overview of why these issues are so critical, laying the groundwork for the conversation to come. Someone who could speak to briefly what happens when children don't receive services, Preem, but we also know what happens when the kids get the care they need. And I'm a living example of that. Preem can speak as a child who did not get the care they needed. I know Preem personally, and she's out there. She's working right now with the youth and everything. So I know she definitely has a message to give each and every last one of us. Preem.
Thanks. I feel like I did get some of the supports. My name is Aprecia Preem Bay. I am a member of the council as well as a founder of a nonprofit here in the city of Albany that's focused on sports. I created the nonprofit based on some of the results that I received over 17 years ago as a person that had received outpatient clinic services. One of my parents was unfortunately killed by gun violence in Atlanta, Georgia, which moved us here. I'm originally from Spanish Harlem. And oftentimes I was in residential programs or crisis respite centers. Respite is for youth who are not into long-term housing, but into almost like emergency housing based on the services given to the family. I feel like I received the services that I needed to a certain point, and the reason why I feel like I received those services is because it gave me a break from all of the trauma and desperatism that was in my home. And I have the youth program that focuses on boxing. I'm a Team USA boxing coach that travels and teaches other coaches how to box. And it was very important for me to learn all of the mechanics of boxing to teach youth about self-discipline as well as self-defense. I built a lot of relationships with young people who are here based on interacting with them after they need mediation for adversarial interactions with other youth. It never stopped and dawned on me that some people have never experienced really traumatic moments, including gun violence. And while speaking with Brad from Families Together in New York State and Cheryl, I was able to realize that. So the scope of my work is not all focused on the trauma, but focused on how to make the connections and why it's important to be able to have the services so that there's no gap and that the social determinants of health are addressed. And that's what the Healthy Minds, Healthy Kids helps to do by making sure that our message is heard and that we are pushing policy and budget in the right way so that families can be addressed. Young people and poor people predominantly in Black neighborhoods are the exact people who need to be able to access healing through what we said is Medicaid. Most of the clinics and trauma therapy that I received as a youth was through Medicaid. I know that the youth that I work with deserve the more opportunities to heal from trauma. Some of the challenges that they run into is that certain organizations don't have enough capacity to be able to answer calls, or they're not, they're either one side or the other, either very clinical or very community-based. It creates a gap for youth who may be experiencing loss of a parent, and it doesn't have to be through gun violence, it could be just natural death or seeing violence in the home. To some members of the public and state leaders who watch the news and judge the actions of people from communities like mine, behind every headline is someone hurting a child or a child in pain or who's hurt may have never been addressed. Our kids don't need any type of judgment. The families don't need the judgment. The children don't need the judgment. They need a lot of understanding that comes with capacity building. They need empathy and they need the space and permission to be still, to be vulnerable and to heal. And that's why it's very important that we are all working together with the council to be able to communicate to the governor our ask. We need access to youth mental health services that are timely and available in our home and community. Sometimes the wait is too late. You don't want a family or an individual or a youth to do more risky things that can be detrimental to their emotional and physical health. So we need to invest more in community-based mental health and in the wait list, because the wait is going to be too late for a lot of families, and that's most. My name is Apricia Preem-Kabe, and I'm happy to speak with you all on behalf of the council. And please look more into HK, Healthy Minds, Healthy Kids, and the work that we are doing to be able to get our message across.
Thank you, Preem, for not only sharing your journey, the story that you had growing up, and that led you to, I think, the very important work that you're doing in the Albany region, but also with our campaign and with children and young people across our state. I think Preem would echo how important it is for us to continue to work with and connect with young people directly to make sure that we not only support them, but elevate their voice in being leaders in this work and telling us adults, those decision makers that are making changes and decisions for them, what type of changes are essential so that way they can thrive nowadays. And I think a lot of the important work that Preem and others are doing are really indicative of a future that we want to continue to have and make sure that our young people have as well. So Our next speaker, now speaking of young people, our next speaker is a youth advocate from Long Island. I'm excited to announce and to have Cody here share a little bit about who he is, what his experience has been, and talk with you all about the impact of not receiving care when young people need it the most. So Cody, welcome to the stage, and hope you can share a little bit of insight on what you think will make a difference, especially for young people.
Okay. Can you hear me well?
Yes, we hear you.
Okay. Like switch to a different computer. So it's a little new. Okay. Hello, my name is Cody Houtman. I am a 17-year-old biracial high school senior from Suffolk County. I joined the Healthy Minds, Healthy Kids Council in hopes that my story can help change a broken children's mental health system, and that others will not have to endure the years of trauma like I have as a result of a lack of proper mental health care and treatment. My story begins at a very young age. I received my first mental health diagnosis and was placed on medication at just 3 years old. My first inpatient psychiatric hospitalization happened when, oh wait, I already read that, I think. No, I didn't. My bad. I received my first mental health My first inpatient psychiatric hospitalization happened when I was only 4 years old. A 4-year-old like myself should not have had to go into an inpatient hospitalization. Instead, should have received proper outpatient care. By the time I was 9, I had already been handcuffed and taken in the back of a police car 12 times to drive 45 minutes away to the nearest psychiatric hospital emergency room. 12 times is 12 times too many. My mother worked endlessly trying to get me a proper outpatient support, but they just weren't available due to the lack of proper services for me to remain home. I wound up going to a community residence and then from there, a residential treatment center. After 2 years in the residential treatment center, I was able to return home. I was 12 years old and discharged to home and community-based services. I also known as HCBS services, as well as children were nowhere to be found. Wait. HCBS services, as well as child and family treatment support services, known as CFTSS services. However, those services were nowhere to be found. I sat on waitlist after waitlist. While on waitlist for those services, I had my first suicide attempt. I believe if I had the services I needed that were deemed medically necessary for me, I wouldn't have had yet attempts. I had 2 more suicide attempts after. From the time I was 4 until April of 2022, I had about 20 inpatient psychiatric hospitalizations. The majority of these could have been prevented had I had the proper services. The truth is these hospitalizations don't teach me how to cope and use skill techniques while I am at home. This is why it is so important for youth like me to have proper care and community supports. Also, by me being in an inpatient bed due to the lack of my in-home and community supports, I am taking away a hospital bed from a youth who so desperately waits on a list. How is this fair? Not only have I gone through this, but I am watching so many of my friends go through the same thing. Suicide is real, and I continue to watch my friends suffer with their mental health issues. I finally feel like I'm on a better path. I've started working with kids, participating in groups like Healthy Minds, Healthy Kids, and advocating for other youth. But the only reason I feel like I have a chance at healing is because of the community surrounding me. My mom has always fought for me. North Babylon School District, which is my home school district, has continued to support me since the age of 3. They have provided me with all my services that school districts can, and I didn't withhold services due to costs like many surrounding school districts. Being in a school district that cares about my mental health has been important, as they also provide me with a school-based mental health counselor who's been there to support and help advocate for me. My hope is the other school districts will step up and provide all the necessary services, including early intervention to those that need it. I'm lucky to have these kinds of support, but I think about how different things would be in my life had I gotten these services from New York State when I was younger. If I hadn't been put on wait lists for years, instead of getting the help that I needed from my community, I wouldn't have had all these hospitalizations, all these suicide attempts, all these interactions with the police, and all the trauma that I'm dealing with. Sometimes I feel like it's too late for me, but I know it's not too late for other young people. That's why I'm trying to fight to make sure the next generation doesn't have to go through what I went through. I'm doing my part to help other young people and fight for a better future, but we need our state leaders to step up and do the same. No child should go through what I did. No young person should feel like I did. I was waiting years for services that never came. I don't want a single young person to suffer or lose their life because our state leaders don't care enough. So I'm joining everyone on this call and in this audience by calling on the governor, the legislator, and our mental health systems to do the right by children and families and invest in care and services we so desperately need.
Great. Thank you so much, Cody, for sharing your story and your perspective on how we can be there and support young children and young adults now with the type of experiences that you've been going through. And I will personally say, Cody, like, I'm really proud of just how you have stepped up and been a part of this council and this group that we have formed since the end of 2022. And we just want to say throughout this entire journey, you have shown not only tremendous courage, but also growth. And with your opportunities that you're going into as you are starting your first job, working with other peers and supporting other younger children who might have the same needs or different needs that you have, I can really say I'm excited and really proud of what you have been able to do for yourself and for your community. So I hope you're feeling the same way as well. So thank you, Cody, for sharing a few words with us. So next, I want to pass it now back to Diane, who will introduce our next round of speakers. So Diane, can you introduce us to Faith and get us started with our next segment?
I would be more than glad to. And Cody, thank you so much for sharing. Oh, they have to hear you. They have to hear our youth. Our next speaker is Faith Beadley, parent from Rochester, who will talk about an overview of the depth of the needs of children and families facing and accessing critical mental health services and the impact wait lists have on them. Welcome to the conversation, Faith.
Thank you, Diane, and good evening, everyone. I'm a parent. I'm a mom who has, mental health needs as well. But I am a parent, and I understand where a lot of parents feel that they don't have the resources out there, and it is hard, but we're going to get through this and we're going to get through it together. But I do want to talk a little bit about I want to talk about providers and choices, and I want to talk about supports. First off, I want to start off with choices because I know that in certain counties where it is that people live, services are not available. And if they are available, then it's very scarce. And that comes along with pay as well. So I'll talk about providers, but a lot of times people don't get the services that they need because the pay isn't there. And we do work hard as family peer advocates, as parents, and as people who are working in the field. Secondly, when it comes to choices, I believe that parents and caregivers and also the children should have a choice where they take where they go for mental health. We don't want to go just anywhere, and we want to make sure that who it is that we get is really going to be providing the care that our children need, and not just look at our children as a number or a statistic, or just another guinea pig, that they can use medication on. And also believe that when it comes to choices, that if the school isn't working out for the child should be set up with additional resources, and the parents should be given what is needed for that child. But I also believe that there are programs that are also out there, day programs that can help with a lot of the things that parents are going through, because parents do need to work, and parents and children do need a break from one another, and children do need to be involved in social emotional health that is out there, and they get that from the interaction of being with other kids their own age. But I also want to talk about providers, because I think that right now when it comes to our providers, that they're just in it because they think there's money. And if you're just going to look at our children as just another moneymaker, then it's not worth it. So when a client goes to see a mental health professional and then they suddenly leave, the trust that is built between that professional and that child is severed. And then all of a sudden that child has to tell their story all over again. So clients feel defeated at times. And providers don't stay long enough because the money isn't there. And that's just a fact, and it's a hard reality. I know people that work in the system, and they don't get paid what they should, and they are great people. And for mental health, it's not just helping, but it should be a healing method. So we want our children to heal. We want them to be able to be successful and to go out into the world and be able to be amongst the community. And lastly, for that piece is that we shouldn't just think of people that come with degrees. Us that have lived experience, that is worth everything. It's worth more than anything because we live it every single day. There are moms that are on this council that live this every day, and we see our children suffer still, but we have to be strong. But my last point is going to be talking about supports. Our kids that go to RTFs, RTCs, and they're awesome. But I also think that when it comes to because the wait lists are so long, that when we have at least a date of when it is that they're coming home, I believe that we should really start looking maybe 6 months to a year, and really start preparing for that child to come home. And secondly, I think there should be choices again, because not every program is going to work for every child. So when they go to an RTF or an RTC, make sure that, you're looking for the quality that you're looking for, and make sure that where it is that you go, that you're going to have access to what it is that you need access to as a parent. And you work along together as a team, and you don't feel like you're in it alone. And lastly, for my supports is that not only should there be support for the children, but there should be parental and family support available as well, because it's not just the child that is going through it. And so the parent and the family needs to be educated, and they need to know the tools and the mechanisms that are going to work within their family. And that's where it is that us family peer advocates come in at. This is where it is that we can sit down with a parent and say, I know what you're going through. Your story may not be like mine, but I know what you're going through. And that really does help a lot, but it has to be done in a timely fashion. So those are my points. Thank you very much for listening. And please just go to our website, support us, look at what it is that we do. And just, if you like what we do, reach out. And whatever you're going through, just know that it's not the end. Everything may not work out how it should. But when there's love in your family, that's what matters most. Thank you.
Thank you, Faith. So Diane, would you like to introduce our next speaker, who will build on
Oh,
what Faith is discussing here and some of the points that she made?
oh, Faith, thank you. Thank you. You're opening up the doors for our ears to hear and to the listening part. I truly just want to say thank you. Oh my God. Just we're there, we're living it, but we want other people to know what we're going through. We want other parents that's on, I see, and on our chat and everything like that. You're not by yourself. Please connect with us after this here meeting. Please connect with us. Next, I'm going to be introducing Anya. Oh my God, Anya. Oh, and now I'm going to turn it over. Oh, to Anya. I'm just like overwhelmed because she's another young youth that has a point that she wants to make to all of us to hear. So Anya, we are ready for you. We
I'm
are
ready,
ready
Miss
for you,
Diane.
Anya.
Okay, good evening, everybody. While I'm had the time first, a couple of my classmates are on here, so I just want to say thank you guys for coming. You didn't have to, so I appreciate it, and I'm glad that you find mental health just as important. With that being said, good evening. My name is Anya Garcia, and I'm currently a senior studying at SUNY Fredonia. I'm studying criminal justice and sociology. I've struggled with my mental health since I was very young, but beginning around 7th grade, I knew that I may need to ask for help. The only issue was there really wasn't any help. And I was told many times that there's people who need services more than me. Whatever that means. COVID only made things worse. Long wait lists, staff turnover, among other things, left me feeling like I didn't matter. And clearly I didn't. Not even enough to get help. It didn't matter how many times, sorry guys. It didn't matter how many times I screamed and begged. It didn't matter how many panic attacks I had, or how many times I relapsed on self-harm. Nothing mattered. I did not matter. Oh. As time went on, the depression, the anxiety, and the self-harm only got worse. I was, and some days still am, literally fighting for my life. By myself, might I add. Nothing has improved. Services are just as bad as they were when I was in 7th grade. As a current SUNY student, I can tell you that our entire campus only has 2, maybe 3 counselors for over 3,000 students. Let that sink in. 3,000 students and 2 or 3 people that are available to help. We as youth and young adults are drowning, and the fix is quite simple. Invest in our mental health, invest in youth and family peer advocates, pay the providers what they deserve, and invest in our futures like lives depend on it. Because some days, mine does. And I deserve better. We all deserve better. Thank you.
Great. Thank you so much, Anya, for sharing a little bit about your own experience. And I know, Anya, will have you come back with us in a moment, so that way you and your mom can have a conversation and talk a little bit about your journey further. But I did want to introduce and connect Carol Murdy, who are going to build on some important points made both by Faith and Anya. And Carol, who is a part of our council, will talk a little bit about what happens when we don't intervene early and the impact this can have on education for our young people in our education spaces, as well as other challenges that children and families face that were excellently highlighted by both Faith and Anya. So Carol, if you don't mind, would you be able to introduce yourself and talk to us more a little bit about that?
Sure. Hi, my name's Carol Murdy and I reside in Tioga County. I appreciate everyone being here tonight for the Speak Out. I am a parent of a child with autism spectrum disorder. I will speak tonight about the impact that mental health and behavioral health wait lists have had on my daughter, her education, and our family. Children with ASD have high rates of having at least one co-occurring mental health condition, and that may exacerbate ASD symptoms or interfere with optimal outcomes for ASD treatments. Mental health disorders can also mask symptoms of ASD and delay early diagnosis. My daughter went on a waiting list for behavioral health services when she was 5 years old and waited nearly 2 years for those services. It may have been even longer had it not been for school suspensions and displacements that started 1 month into kindergarten. These exclusionary practices and traumatic events made her a priority within the treating facility. However, so much damage had already been done while she was lingering on a wait list. In these nearly 2 years of waiting for behavioral support, my daughter lost access to all the things that most children take for granted, specifically her education. All of the things she loved were taken away over and over again while she waited for behavioral health services, as she was suspended and displaced to other buildings and programs over 7 times before 3rd grade, and ultimately just pushed out and is currently on another wait list for a program with no openings and a program that is not even appropriate for her needs. Just imagine what that is like for a child with autism, or any child really, whose most critical need for success is routine, predictability, and stability. While she waited for services, she grew depressed. She had feelings of isolation and feelings of hopelessness and rejection, feelings that no elementary school child should ever have to feel. And certainly no parent should ever have to hear their 7-year-old child tell them they don't want to be in this world anymore. Nearly 4 years later, my daughter is still trying to overcome the devastating impact she endured while being on a wait list. These were her formative years, and she continues to work through that trauma in counseling. I found an article written by Kate Mitchell for New York University Review of Law and Social Change that I wanted to share. And she stated that while we know that exclusionary discipline practices destroy the lives and opportunities of young people, public schools persist in suspending nearly 3 million students per year, including nearly 700,000 students with disabilities. A disproportionate number of those suspended students are students with behavioral health conditions. Our children in New York State are waiting for help that is not coming fast enough. No child should have their mental or behavioral health challenges further exacerbated by a system that is making them wait weeks, months, or years for needed services. Everything in that child's life is altered and suffers from the impact of wait lists. My daughter lost hundreds of hours of school instruction due to exclusionary discipline. She lost her confidence and self-esteem and her sense of belonging in our community. And this is often the case when one child is excluded from school and their sibling is unaffected. Our family and our way of life were also altered. I had to leave my job to become a full-time stay-at-home parent and educator of my daughter. This was not in my life plan, and we were not prepared to be a one-income family. The stress from this situation has taken a physical toll on both me and my wife, both enduring health issues that are aggravated by stress. Advocating for your child's legal rights is expensive, time-consuming, and very frustrating. My relationship with my daughter is strained because I went from a parent to a teacher, and this is a huge burden on both of us and changed the dynamics of our relationship. Our fear as parents is that the damage that has been done to our daughter because of unmet behavioral health needs will have a long-term effect on her education and we are left wondering if she will graduate. She is a bright and eager student, but she started being suspended in kindergarten, a place where she was supposed to be making lifelong friends, learning acceptance, and how to be part of a larger community outside of our home. But instead, she learned what it was like to be excluded and to feel unworthy due to challenges that she had no control over and no timely access to behavioral health support in her state. Only time will tell if resiliency and a little bit of luck will win out in the end. We did everything right as parents and got our daughter the best early intervention supports available. And then when she aged out of early intervention, New York State completely let her and our entire family down by placing her on endless wait lists that has potentially altered her future. The practice of school push out has left our daughter without a school and our family in pieces. I'm very sorry. Trying to put itself back together in a way that will have the best ultimate outcome for our daughter. If you are not aware of the term school push out, I urge you to look it up. We are potentially losing some of our brightest stars to waitlists in New York State. It is unacceptable for any New Yorker to be turning a blind eye to children in need. There's no way around making an investment. New Yorkers will invest today to get children the timely access to the mental and behavioral health services they need to be contributing, successful members of society. Excuse me. Or they will invest tomorrow in supporting these children as struggling adults needing various systems of support. We have the ability to change the trajectory of these children's lives. 2 years too late, my daughter successfully completed a year of intensive behavioral therapy at home. Today, she is weeks away from being offered medication using strategies that she has learned from professionals, and she is thriving. However, nothing can undo what took place, and we can't go back and redo all of the years she missed. We just have to have faith and move forward and ensure this stops happening to our children of New York. Let's get this done. Thank you for listening.
Thank you, Carol, for sharing your story and the journey that you've been taking with you and your daughter and your family. And I think I just want to pause here to say to our audience, you know, we've heard now from a few of our speakers, some of the parents, some of the young people, talking from their own perspectives, what their own lives and what is happening in their communities has really demonstrated how far we still need to go to make sure that not only you all, whether it's other advocates, other families, other parents, or other young people have experiences around this, but how our state leaders and other audience members in this room can know and become more aware of what some of our young people and parents are facing. Now, I want to next introduce Brad Hansen, who's the policy director at Families Together in New York State, to help facilitate a conversation not only with one person, but between two people, a mother and a daughter. So Brad, please let us know this conversation that you have worked with them on and what we can expect to hear and learn from both Bethany's and Anya's experience.
Thanks, Carlos. Anya, you know, I think you and I and Bethany together have spent hours talking about what you went through. And yet one more time, somehow I feel myself feeling so just blown away and moved by what you were saying. And I'm so, your story and your strength, and I'm so happy that so many people are on this call today to hear it. But so many of us get to hear all the time, you know, when we wonder, you know, when things are getting hard, to advocate. You know, it feels like you're pushing a stone up the hill, and so many things feel that way. One of the things that gives us strength is hearing from people who have persevered. And I think everybody in this chat, everybody that's in the council agrees. We understand how you're feeling, but you matter so much. And I don't think there's anyone in this room who feels that way more than your mom. And so we have this unique opportunity to sort of have a conversation, right? You know, we've heard Anya's perspective as a young person trying to get the help she needed, trying to move through these struggles, these very human struggles we all go through, right? But sometimes they don't get the help they need when they need it. And that's what we're here to talk about today. But Bethany is the parent in that situation. And she has a very different perspective on on what transpired there. And so I want to invite Bethany in to just reveal like a little bit of what that was like for you to try to help your daughter find the service that she needed and heal. Why don't you share with the audience a little bit? You're on mute.
Okay, can you hear me now?
Yeah.
So I'll introduce myself first. My name is Bethany. I'm a member of Healthy Minds, Healthy Kids campaign. I invited my daughter, Anya, to also be a member of the campaign. I also am a New York State credentialed family peer advocate in Buffalo, New York. And as everyone now knows, I am Anya's mom. I was an adopted child who spent time in foster care. And, you know, I dealt with my own depression and anxiety, and obviously participated in some risky behaviors because I didn't have the guidance or support that I really needed. I was a teen mom to 4 kids, and, you know, I was raised in survival mode. And unfortunately, my kids were as well. It wasn't really until Anya kind of came along, who she had kind of witnessed, you know, all the trauma and all the things she'd seen me going through with her siblings. And it was really her who kind of was like, made me look at things a little bit different. You know, I took the time to admit to myself and to my family that I was the victim of generational trauma. And, you know, Anya made me see that the time was now. To, you know, the pain had to stop now. Our family's healing has to begin now. And I made a commitment to all my children, but especially to Anya, that, you know, they wouldn't inherit my scars, but instead my resilience, my courage, and my ability to be able to make this change. And I think that Anya and I, it's a battle every day, and we're still going through it, but we learn from each other. I really struggled when Anya was beginning to go through her mental health, because as a mom, I saw it happening. And it's heartbreaking to watch your child, I'm sorry, I don't want to get emotional, but to see cuts on your child, or to see, you know, to hear your child say that she didn't want to live anymore. And I tried my best to reach out and to make the connections and to get appointments. And I had to be the mom, you know, that told her, I called, but, you know, I can't get through. There isn't an appointment, or, you know, and it really put a burden on our relationship, because I think she felt, you know, and she can attest to it herself, that I really wasn't taking it seriously. And that was really hard on our relationship. You know, like I said, it's a daily thing. You know, we've been going through it for a long time. When I would get her into therapy, you know, people would change, and all of a sudden, then we'd go back 2-3 weeks later, there'd be another counselor, and we'd have to start all over again. And she'd get frustrated. And I, as the mom, know it's the right thing to do. Like, no, we got to keep this up. We got to keep going. But it's, what do you tell your kid? Like, you know, you're put in this position where what do I tell my kid who's tired of telling her story over and over again? You know, we spent many nights, I used to call them sleepovers, and I'd be like, Anya, come lay with me. And Anya didn't know at the time, but I just wanted to make sure she was alive. That's how bad it really got with us. And, you know, as a mom, there's nothing I wouldn't do for her. And we need to make this change. As you heard, she's now in college, still struggling with the same things. And I still cry myself to sleep every night because now I can't tell her to come downstairs because she's off at college and she still is fighting to receive the services that she desperately needs. So that's my part of it.
I appreciate that so much. And I know, and all of us understand just how hard it is to be vulnerable like this and in a space like this. But I think I'm seeing in the chat that everyone, so many of us have gone through similar things, and you know, we care for each other. And I appreciate you sharing that. Anya, I want to invite you to weigh in or react or comfort your mother, whatever it is. But I just want you to know you can unmute and you can speak.
Yeah. I don't know if any of you can see me. I can't see myself right now, but that's okay. I don't need to see myself. I just, Mom, you know how I feel about that. I am very appreciative of your resilience because I got that, but also that as a parent, you understood that it's not just about you. You made it about your kids, and a lot of parents don't understand that because they don't know how to deal with their trauma because they never knew it was okay to deal with their trauma. So I just appreciate you. You did what you could, and you, like you tell me, you can't save the world, right? So you're not the whole mental health system. You can advocate for my services till you're blue in the face, and you do. I watch you go to bat for me every single time, especially when it comes to my health. But again, you can't force people to pay people the money they deserve. You can't force people to care about my mental health the way that you care about my mental health. So I just appreciate you for always trying and, you know, also prioritizing your mental health as you prioritize ours, because like you said, you were built on survival mode, but understanding that there is no age limit on being able to deal with your trauma. So I know this is about youth 100%, but adults that are in this room as well, you're never too old to heal from trauma. You're never too old to get services you deserve. But if we were to provide those services to the youth, you wouldn't have people like my mother who are trying to find these services 10, 15, 20 years later, after they already went through everything they went through. You know, so I think that it's really important to kind of work at the root of the problem so that they don't get this much bigger, and then we don't have generational trauma created because we're fixing everything at the start of the issue. That's all.
Yeah, I want to just feed off that. You know, I really, you know, open people up in here, whether, you know, you're young people or you are parents, to start having these conversations with your kids. You know, Anya and I have one of the people tell us all the time that how jealous they are of our relationship. And we're just like, what? Like, she drives me nuts, you know? But like, we know that like, it's a safe place. You know, she's a safe place and she knows that I'm a safe place. And we, you know, we've learned how to do that between each other. We have boundaries that we've set up, you know, for each other. And we're very, you know, very respectful of that. You know, my goal as a mom, you know, obviously is just, you know, to stop the generational trauma and not have my grandkids, you know, if she has any, or, you know, just be born into this, you know, like, it's just such an important thing to do. And I've learned so much. You know, they say that we, you know, that our kids learn from us. I've learned so much from my daughter, and I couldn't be more proud of the woman she's turning into, because her resilience, her courage, and her strength, you know, she's saved my life. And I just want to give her all the props for that. So I encourage you all to have these conversations with your families, with your parents, with whoever you can, you know, and just learn about advocacy, because that's the only way that we're going to get this to change, is really to advocate. I've been taking Anya to Albany since she could probably, you know, talk. It's important. And, you know, I just would ask that we all do it.
Thank you both so much. I don't really think there's much more to say. There's so much wisdom and every bit that you both shared. And Anya, you're right, it's never too late. And Bethany, absolutely, let's be safe spaces for each other. Those are two great lessons to walk away with. And then lastly, most importantly, let's get these freaking services. No more wait lists.
Not all.
All right, Carlos, back to you.
Thank you, Brad. Thank you, Bethany, Anya, and I definitely echo what I've been seeing in the chat and what has been said, that this can be very emotional and tasking work on us, whether it is us that is going through some type of help that we're seeking or needing, or trying to support a loved one and make sure that our families are coping as best as they can to get through these really real and challenging situations. And so I know that we've seen many people get emotional and pause because of how hard it is to talk about this sometimes. And I just want to echo that, as part of this work, it is important to do this, but also take the moment to allow these types of feelings and emotions to exist in spaces like these, where we talk about what is really happening in our homes and what's really happening in our communities. And so I'm going to switch the order a bit to make sure that we get to one of our speakers who will need to step off soon. So I want to introduce Tamara, who is going to talk about the emotional toll that parents experience while navigating this complicated system, talking about whether it's dealing with insurance or waivers or barriers and stepbacks that come across families or a parent when they're trying to access service for their children. So Tamara, I'll pass it on to you to speak for a few minutes before we get to our final segment of the program.
Thank you very much, Carlos. My name is Tamara Bigel. I am a Long Island mom, co-president of Long Island Families Together, and a Healthy Minds, Healthy Kids Council member. The mental health system of care has completely broken. It has shifted the responsibility onto the shoulders of a dizzying number of agencies, government officials, so that no one agency is actually responsible for ensuring that quality care is actually given. The system is a labyrinth of paperwork, forms, and roadblocks, theoretically to weed out people who don't qualify, while it's actually placing stumbling blocks in front of unsuspecting parents that deter them from receiving the services that they need. The system doesn't work, breaks down in hundreds of different ways, and causes more trauma to individuals who are already traumatized. I fought this system for 6 years before my son was placed in a long-term hospitalization and then residential treatment. It has been almost 4 years while he has been in treatment, and for 3 years of those, he was placed 8 hours away from my home, from a family who loved him, just to be able to receive the education and therapy that he needed. No child should be separated that long from the physical and emotional love and care of their family. His needs were not that unique or special. He required a Regents level education with special educators in dyslexia who were trauma informed and autism trained. Please understand, my son's requirements for education and therapy could have been obtained in my home, but because of the workforce crisis, ghost networks, lack of skill builders, peers for private insurance holders, and lack of in-home services that he received at a young age, the problems were compounded. He was not identified and given the needed services until his behaviors were so severe that his needs could not be met in my home. And then tens of thousands of dollars had to be spent by school and the public so that he could be cared for and educated 8 hours away from his family. It would have been cheaper, more efficient, more effective to have given him those services when he was a baby and then withdraw them when they were no longer needed. I did not sit idly by while my son was in treatment. I fought besides the top advocates in the country demanding better health care for our children, helping to change laws and ensure that workers who make a difference receive a living wage. I went through countless hours of therapy to heal my own individual and generational trauma, learned new techniques for supporting my son, and find ways to connect with my child and ensure our bond grew stronger despite the distance. I also devoted over 1,000 hours volunteering to help other families, both individually and in groups, to navigate this system so that their children can receive the help they needed while ensuring that other parents would not have to navigate the system alone. My son's hard work is paying off. There's a good chance that he can return to our family home and go to a local school to finish out the last year and a half of his public education. However, I'm faced with a system that is so fundamentally broken that despite my efforts and skill navigating the system, I justifiably fear that all the work that my son and I did will be for naught because he won't get the supports he needs when he returns. Despite our advocacy, there is a serious workforce crisis plaguing New York State. Long Island, where I live, has one of the highest costs of living. Home-based providers are not paid a living wage, cannot afford the transportation, nor do they receive pay and reimbursement for their time and travel and coordination needed when helping children. Most peer advocates require several full-time equivalent jobs to be able to earn a living wage to afford to feed and house their families. This does not even take into account the emotional toll and physical toll of being away from their own families during prime family time, since visits must be done when a child is at home, not during the workday. Although one agency on Long Island has enough peer advocates to fully support their clientele, and they can only provide services to those with Medicaid. Every year, we ask state leaders to provide funding for home and community-based mental health care for children, and the state introduces brand new flashy programs to help individuals in the community. The problem is that the new program is only for a select few in number in a small number of areas in New York. There isn't enough money to pay the providers needed to run the programs. And while it may help some families, it doesn't put a dent into helping the large amount of children and families that need services. It is time for all of us parents and all of us young adults and all of us children to combine forces and fight for the services that our family and children need. We must demand that that our community and home-based services are reimbursed at the right rate so that we can get a workforce. We know the answer to the workforce crisis is paying people a living wage, and that must happen. Healthy Minds, Healthy Kids is going to introduce something that will make a dent in this problem. So I encourage you to join us and act.
Thank you so much, Tamara, for really being a fierce advocate and powerful advocate, not only for your own child, but for all of us here in the campaign and for so many other families that you've stepped up to support with while you yourself are going through your own needs and trying to support your own family through these difficult challenges and this complicated system sometimes, and making sure you get the support you need for the ones that you love as well. I really appreciate the moments and the vigor you have in advocating with us. And I think it is you, like so many of our other speakers today, that we need to make sure that those decision makers, lawmakers, policymakers really need to hear from. So that way we can make sure that this crisis ends today and that this current and future generation don't have to go through the same repetitive cycles that we're seeing. So appreciate your time and appreciate you being here to share this and your experience with us as well. So now to close our program out, we have two speakers that will be joining us First, Andrea, who is a supervisor of JCCA's Westchester Day Treatment Program, will take a few moments to speak about how the lack of adequate resources impact children and youth, tying in the provider perspective as well. And then Alice will join us to talk a little bit about what we are doing and what we must do to take action collectively to ensure that all our speakers, all our young people, the parents, caregivers who are fighting across our state for our loved one and communities really get the support that they need to make sure that we address these issues around wait lists, access to care and services, and other relevant impact that communities are facing here and today. So Andrea, if you would go ahead and introduce yourself and tell us what you have to share that you see with the children and youth that you work with.
Absolutely. Thank you so much, Carlos. Hi, everybody. It is an absolute privilege to be here with you all tonight. My name is Andrea Semino, and I am the supervisor of JCCA's Westchester Day Treatment Program. At our day treatment program, we serve youth ages 5 to 21 from not only the 5 boroughs of New York City and Westchester County, but people come from as far as Orange County, Putnam County, and Dutchess County because of the lack of mental health services that are available. Our program is essentially a middle ground, so to speak, between outpatient therapy services and higher levels of care such as inpatient or residential. Our program is based within a school, specifically Hawthorne Cedar Knolls School District, and we pull the kiddos from their classes for their therapy sessions. Instead of worrying about transportation to an appointment after school or worrying about childcare of your other children while you take your child to their appointment, your child simply receives mental health services within their school setting. The need for our program is a strong one, and unfortunately, our waitlist is ever growing. For many reasons, including limited staffing and program capacity, children will be on our waitlist for months at a time before they can finally move forward with the intake process. This wait can be a significant barrier for clients and families, many of whom, just like yourselves, are looking for immediate support and treatment for their child's mental health. Mental health resources are extremely limited overall, especially the farther from the city you go. As a result of limited services within their own communities, children and families are traveling for hours at a time in order to access mental health services in other counties. JCCA's Westchester Day Treatment Program is the only day treatment program in Westchester County, and combined with the statewide closing of residential treatment facilities, there are minimal options for kiddos who need that extra support. Consequently, children with varying needs of behavior support are all competing against each other for these limited mental health service options. An additional barrier to mental health services is the limited number of bilingual clinicians. New York especially is a melting pot, and we serve children from a variety of cultures and ethnicities. Research amongst multilanguage speakers has indicated that people are better able to talk about traumatic events, particularly traumatic childhood events, in their first language. Having access to bilingual clinicians could be a great support in addressing the complex mental health needs of our kiddos. The need for mental health service has already been a great need, but as we have transitioned through the global pandemic and into post-pandemic life, that need for mental health services has become dire. However, the fact that we are all here and uniting gives me hope. I have seen the progress that can be made when children are able to receive mental health services. I love seeing moments where children have insight into their behaviors, can understand themselves, can talk about difficult emotions, and are comfortable enough to feel both vulnerable and safe simultaneously. I am here with you all to join the request for resources to provide this support. Thank you all for your time.
Great. Thank you, Andrea. And now, connecting to what you've addressed here regarding wait lists and how we can advocate and begin making movement so that way parents and young people get these supports in a more timely fashion. I want to pass it over to Alice, who can now talk about how we can take these recommendations and these changes that you have uplifted into action that we can bring to policymakers and at the state level. So Alice, I'll pass it off to you to talk a little bit about what people can do to act and what they can expect in the coming months as we advocate.
Thanks, Carlos. Hi, everyone. My name is Alice Buffkin. I am the Associate Executive Director of Policy at Citizens Committee for Children. I can't express how proud and touched I am to be working with so many incredible parents and young people and advocates on this council, including those who have been on the meeting today. I want to just draw attention to a couple of key things that we've been hearing. We have a system that needs to support children and families as early as possible. You've heard about the times that families saw the positive change when young people received the mental health services they needed, but it always comes with the wish that those services had come earlier, before the hospitalizations, before the out-of-home placements, before the expulsions, before the trauma and heartache. And I think we all recognize there are far too families across the state for whom those services have never come. I think we also know resources matter. Funding matters. Budget decisions are moral decisions. Where our state puts funding has a direct impact on the health, the well-being, and the future of our children. Our state has spent decades starving the system for mental health. And Governor Hochul is a champion for behavioral health, and that has been fantastic. We've seen some critical investments in the system. We've seen some vital reforms to our system. But as you've heard from Cody, from Tamara, from Carol, from Faith, from Anya, from Bethany, it's not enough if it's only available to some families in the state. It is hard to talk about the progress we made when we just heard from a half dozen young people and parents about how they can't get the services they need. And for every story here today, there are thousands more across the state. We need statewide, system-wide solutions. So that brings us to what we can do about this. We worked with a group called Health Management Associates to answer the question, what reforms and investments are needed to stop the waitlist crisis and put us on a path toward increasing access to care across the state? And where we landed is that we need an investment of $195 million in this budget to reform the children's behavioral health outpatient system. With this investment, we could address low pay, chronic provider shortages, and unacceptable waitlists. We could hire 1,300 new behavioral health professionals and serve an additional 26,000 children. So we are urging you to join us in asking our state leaders to make this investment. You can start by submitting the Take Action that's been shared on the side, but we are going to have so many more opportunities for you to engage with us. And we view this $195 million as just the start. We know from our studies that 80% of children who need services in the state aren't getting them. So we need a multi-year investment building on this $195 million as a down payment on the future of children and families. We have to think big because we can't afford not to. What does it mean to have a system that gets every child the services they need when they need it? That's what we should be aspiring to, and that's what our state leaders should be aspiring to as well. So Carlos, I will hand it back to you.
Thank you so much, Alice. And I appreciate and am so grateful for everyone of our speakers who joined us here today. As Alice mentioned, this is just the starting point for us. And we believe that the best place to begin the conversation is to hear from parents, hear from our caregivers, hear from our young people about what they are experiencing and what they are seeing, so we can become energized, mobilized, and ready to support not only them, but the thousands of other families and young people throughout our New York State that need us to advocate with them to make sure that the needed services, these issues around access to care and wait lists that they are experiencing end here today and this year, as we make sure that the budget has the supports needed to end that type of crisis. And so again, in the chat, you'll have access to ways you can connect and support. We are grateful for all of you for staying and allowing our speakers a little bit of extra time to hear and share their own experiences, and hope that you join us in the coming weeks and months as we advocate for these and other types of change to our mental and behavioral health system. Thank you again, everyone, to all our speakers and to our audience here today. We hope to see you soon, and we'll be in touch to share more about how you can get involved and act with us. Have a good evening, everyone. Thank you and good night.